Hello everyone, my name is Victor and this is Safira, and we'll be making a video showing you guys how to make a surgical pack, how to wrap it appropriately, and I'll be having all these instruments in front of me, letting you know what to use, how to do them, and how to wrap. So in front of me I have my instruments. This is everything that is needed. So in this case, you have your Mayo scissors, needle drivers, you got your sutures, you got your sterile gauze, sterile strip. In this case, I'll be using a tray. The tray, we like having a little bit of, not paper towels obviously, but I mean some type of cloth on the bottom. And then this is my drape here. And on the bottom, this blue is the drape to wrap the pack. So this is pretty much everything that is needed. In order to appropriately wrap the pack, you want to make sure everything is laid out nice and organized in a way. The instruments, we like having from biggest to smallest. Alright, so from biggest to smallest, and then once you have all the instruments already laid out, you want to go ahead and grab the tray and start putting the instruments in here. One thing that you got to make sure is that the instruments are not just thrown in there, also that they're nice and organized so the doctor can pick and choose whatever they need from the tray. Also that they're not clamped. You want to make sure that they're not clamped, and then that they're all facing the one way. So now I'm starting to put them in. This beautiful instruments that I have here. Okay. All right, this is the sterile strip. The sterile strip is pretty much placed inside of the tray, and it's an indicator that the instruments or everything that's inside of the tray is actually ran through the autoclave, and it's giving you an indicator that it's sterile. That's how you place it. So also you want to go ahead and put your gauze. One thing about the gauze, you want to count how many gauzes you're putting in there. So if there's 20, you gotta either it should be like a standard protocol for your packs that you're putting in a certain number of gauze, just because it has happened in the past that the gauze has been left in there, or some doctors in accident they end up forgetting gauze inside of the abdomen cavity for the animals. So now that you have this, I will show you how to fold the drape. The drape should be folded accordion style. So this is pretty much how it's done. So you want to make sure you fold one way, fold the other, all the way through. So this is pretty much how it's folded, and now you have to fold. Yeah, it's a little rough doing it with this pillowcase. Once you have your drape nicely folded, you want to grab one of the top lips of the drape and fold it this way, so once the doctor grabs the drape from in there, they can just grab it from here. This drape could be placed inside of your tray as well. Okay, now that we have everything nice and organized in there, we're gonna wrap the pack, okay? So you wanna make sure you put your tray almost dead center of it. One thing about wrapping packs is that everything has to be done nice and tight, okay? The tighter the pack, the better. So now that you have this, you want to go ahead and fold this section first. The top section is always first. It's almost like pretty much folding a diaper. Always, always, always leave the flap, or I guess the tip of the drape, pointing inwards. The reason is because whoever's gonna be unwrapping this, they can just grab from the lip and pull it away, and it's on the it will be on the non-sterile side. So this is one. The first little fold doesn't have to be tight, just because, I mean, it's impossible to do it tight. Now this section, you wanna go ahead and, now at this point is where you can actually like start tying this. Like I said, always leave the pointy tip like facing inwards. Now this section, now you're gonna feed it right in here. Once you feed it, you wanna make sure you leave a nice little flap. So this is where whoever's gonna be undoing the drape, they can just pull as such and start unwrapping. I will be showing you later how to unwrap. Give me 1 second. That is my first layer. This is my second layer. Okay, same scenario. Back is hurting. Okay. All right. Same thing. It's literally the same way you wrap the other one, the first one. Same thing, feed it under. Once you feed it under, you want to make sure it's nice and snug. And the tighter the pack is, the better, because there will be more room, obviously, in the autoclave for you to wrap other instruments or other packs that you have to do. This flap has to be facing outside. Okay. And there you have it. This is pretty much how the pack should look. It's nice, looking like a pillow. You want to make sure, like I said, you have your little flap on the outside, okay? At this point, I don't have tape, but you want to make sure you grab two types of tape. Different hospitals, they have different protocols. In class, we use 2 tapes. We use the, I don't even know what the name of that tape is called, to be honest, but you start here and then you mark it all the way to the bottom, and on the bottom of the tape, at the very tip of the tape, you need to have your tab on the tape so you can just grab it and peel it off. The trick to this is actually putting the tab on the bottom, so whenever you're gonna unpeel it, it just opens up. It starts opening your drape. Things that you should be marking on your tape is who wrapped it, your initials, the date, and what type of pack it is. If it's a general pack, if it's a major pack, if it's a mini laceration pack, if it's a eye pack, and so on. Okay, so I'll be showing you how to unwrap it. So if, say, pretend we're having a surgery right now, and this pack was already run through the autoclave. Now it's everything is sterile in here, inside this first outer layer. So this is how you open it appropriately. Your tape, like I said, you grab your tab. Eventually, is gonna open this section. First section, you always throw it away, throw it further away from you, and then you start grabbing the tabs that you left when you wrapped it. So in this case, you throw it this way. Same thing, you throw it that way, and then your last tab. This is pretty much how you open it for the doctor who's scrubbed in already, or whoever's gonna be scrubbed in. So say for example, now I'm the surgeon. Now I'm gonna be opening. I'm sterile in this case. I have gloves and everything. So in this case, this is pretty much what I can touch because I'm sterile. Everything inside this little area, this is my sterile area. This point, you can do the same thing. Start grabbing tabs, opening them and throwing them to the sides, and then same thing. Now you have everything laid out. It's nice and flat, and then it's organized for the doctor to be messing around in his own sterile field. He can definitely grab this strip, and you see how from the tab that we left before, this is pretty much how they grab it, and then they start either gonna place it on the animal or whatever they're gonna do with it. This is pretty much the same type of hand drape that doctors use and pretty much dry their hands whenever they scrub. And then at this point, yep, you see how everything is nice and laid out, and not my sutures. And that's pretty much it. There you have it. If you have any questions, look in the comments, subscribe.